Hi, my name is Ilse Wilken and I'm a registered nurse. I'm going to give you some guidelines with regards to first aid awareness. First aid is offered when a person needs immediate help as it might become a life-threatening situation. First aid awareness in the church context will focus on children and adults and how to address the most common and serious situations within the environment of the church. Here are some general guidelines when providing first aid. Make sure it's safe for you to help the victim. The first aider cannot help the victim if they're also going to get hurt or injured, such as there's a falling or burning building. Wear any available protective material, such as gloves, or use any alternatives, such as plastic bags for your hands. This will avoid any infections. Rather work slow and softly if possible to avoid causing any further harm. A person should always visit a doctor or emergency room after a first aid incident if they are concerned, as the doctor might perform additional tests to determine the severity of the incident, treat the injury correct, or prevent long-term complications. If more than one person is at the emergency scene, the first aider will stay with the person, take control of the situation, and guide all the other individuals what will happen. A person will be delegated to call the mother and father. Another person will then attend to the rest of the children and adults to stay calm, remove them from the scene as it might be dangerous or upsetting, and this will also reassure them. Bee sting. If a person is stung by a bee, we need to remove the stinger. We should not pull it out, but rather scrape it away with an object that's got a flat surface. We will scrape it away, and after we scraped it away, we can clean the area. We can use water, or you can add some soap in the water, or a disinfectant like Savlon or Dettol. We will take some gauze, put it in the water, wring it out, clean the area. Then we can also dry the area. To also decrease the swelling and make the pain less, you can take a plastic bag with some ice in there, you can put it in a cloth and just place it on the area so that the swelling and the pain becomes less. If the person is allergic to bee stings or they're not sure if they're allergic to a bee sting, they should go to the hospital then. EpiPen. An EpiPen is given to people who are very allergic to bee stings. In the EpiPen, the right amount of medicine is already in there to inject the person if they are stung by a bee. For the person to use the EpiPen, firstly check how many layers of clothing the person is wearing. Preferably it should only be one layer of clothing, otherwise you need to remove the additional layers. When you use the pen, you're going to remove the cap. In this case, I'm just going to use a lemon, not to inject myself. When you're going to use the pen, hold on to it and you're going to insert it straight down into the middle of the person's thigh. You're going to insert it, you're going to press at the back and make sure that you inject all the medicine inside. Just keep it there for another 3 seconds to make sure that all the medicine is absorbed. You're going to count 1, 2, 3. You can take it out, just put it in a container, and then the person needs again to go to hospital directly after that. Allergic reaction or anaphylactic shock. A person can have this reaction when they are allergic to something which they might know or might not know of. It can be a food or a drink or something they came in contact with. They might also have an EpiPen that can be used in this instance as well. The signs and symptoms that you look out for is redness, swelling, it might be itchy in the area, and there might be round circles forming in that area. The eyes might also start watering as well as the nose, but the thing we are most concerned about is when the person has difficulty in breathing. Then this person needs to get to the hospital as quickly as possible. I please want you to remember that this video we're making is for first aid awareness. This is not that you are completely competent in first aid. If you want to skill yourself to be a first aider, it is a good idea to do a course, an intensive course, and make sure that you're certified when you want to provide first aid as well as CPR.